Welcome to this session on holistic client case formulation for career counseling. We will walk through an intersectional framework for understanding how clients like Jordan, a 24-year-old Indigenous woman navigating career decisions, bring the full complexity of their lives into the counseling room. Career counseling has historically centered individual choice, motivation, and aptitude. This formulation asks you to do something different, situate the client within their full sociocultural context, attending simultaneously to race, culture, class, tribal identification, gender, age, and disability. The Ad Addressing Framework Hayes 2024, the Cultural Formulation Approach, and Intersectionality Theory give us tools to hold that complexity without reducing it. As you review this case, practice developing formulations that are not merely comprehensive lists of identity categories, but integrated narratives that explain how a specific person arrived at this moment in their career development. This formulation serves two purposes. First, it provides a model for the kind of integrated intersectional career case conceptualization that effective multicultural practice requires. Second, it grounds that model in an established and growing evidence base. The frameworks informing this formulation include the Addising model, developed by Hayes 2024, which maps multiple cultural identity dimensions simultaneously, intersectionality theory as applied to career counseling by Varsik and Gorochovskij 2023, Ewing and colleagues 2022, and Izadi 2020, responsive formulation approaches from the broader counseling literature. One important limitation merits attention from the outset. No single existing model fully integrates all the dimensions you will see here, and tribal sovereignty, in particular, remains significantly underaddressed in the career counseling literature. That gap itself carries practice implications we will return to at the end of this presentation. Meet Jordan. She is 24 years old, Indigenous, and of mixed racial heritage, a first-generation college student with a physical disability, and she has come to her college career center for help figuring out what to do next. Her presenting concerns center on career indecision rooted in identity conflict. She feels pulled between work that reflects her Indigenous community values, including land stewardship, social work, and healing practices, and family pressure to pursue economically stable but culturally disconnected fields. She also carries significant internalized barriers, including imposter syndrome and stereotype threat, shaped by prior racialized educational experiences. At the same time, Jordan brings substantial strengths. 2 years of college completed despite financial hardship and geographic isolation, strong community ties, elder mentorship, and a clear sense of purpose rooted in contribution and healing. What might initially appear to be deficits are best understood as the reasonable responses of a capable person navigating genuinely difficult structural conditions. This formulation rests on 5 interlocking frameworks, and none of them is sufficient on its own. Intersectionality theory, developed by Crenshaw in 1989 and extended to career counseling by Varsik and Gorochovskij 2023, holds that race, gender, disability, class, and tribal affiliation do not operate independently. They interact to produce unique configurations of privilege and oppression that a single-axis analysis will always miss. Cultural humility, articulated by Tervalan and Marie Garsha in 1998, positions the counselor as a learner rather than an expert and requires ongoing self-reflection, acknowledgement of power differentials, and institutional advocacy. Indigenous and decolonial frameworks remind us that colonial legacies, including residential schools, land dispossession, and the erasure of Indigenous knowledge systems, are active forces shaping Jordan's relationship to work, education, and opportunity. The structural determinants and multicultural orientation frameworks complete this approach by directing attention to macro-level forces and the relational quality of the counseling process itself. The formulation itself is organized into 5 interconnected sections. As displayed, each area addresses a distinct dimension of Jordan's career development, but the goal is not to address them separately. The goal is to weave them into a coherent narrative. Step 1 examines how Jordan's racial, ethnic, and gender identities, along with her cultural values, shape what work means to her and what she imagines is possible. The second step explores how financial precarity, educational access, and resource constraints both limit and shape her options. Step 3 focuses on her Indigenous heritage and how community belonging and historical trauma inform her relationship to vocation. In the fourth step, I would consider how emerging adulthood developmental tasks intersect with chronic disability and chronic pain. Step 5 names the structural and institutional forces operating in her life. As you develop your own formulation skills, practice writing these dimensions as a single, integrated story rather than as a checklist. Jordan's vocational identity cannot be understood apart from the identities she holds simultaneously. Her racial and ethnic identity shapes her relationship to mainstream career norms, which tend to reflect white, middle class, able bodied assumptions about good work. Microaggressions in academic settings have eroded her sense of belonging in professional spaces, even as her racial identity remains a source of pride and purpose. Her cultural values, rooted in collectivism, reciprocity, land stewardship, and community healing, are not peripheral to her career goals. They are the center of how she defines meaningful work. Western career frameworks that privilege individual achievement and upward mobility may feel not just irrelevant but harmful to this client. Jordan's career indecision is not a deficit. It reflects the absence of visible role models who look like her and work in ways that feel culturally congruent. That is a structural problem, not a motivational one. A culturally responsive assessment for Jordan begins with a detailed narrative intake that goes well beyond a standard career interest inventory. The intake explores her racial and ethnic identity, tribal affiliation, gender identity, disability experience, and class background, including how discrimination has shaped her educational and vocational experience and what cultural values she holds around work.
Culturally adapted tools, including the addressing framework and strengths-based assessments, help the counselor map intersecting identities, privileges, and oppressions without reducing the client to a checklist.
An environmental scan identifies accessible training opportunities, employers with culturally safe practices, and logistical factors such as transportation, childcare, and geographic proximity. Throughout this process, the counselor maintains cultural humility, following Jordan's lead in defining what matters, what constrains her, and what constitutes success on her own terms. The intervention plan unfolds across 3 phases over 12 months, with the understanding that pacing, sequencing, and goals are always co-created with the client. In the first phase, sessions 1 through 4, the counselor prioritizes building rapport using culturally humble, non-directive approaches. For a client like Jordan, who has had prior racialized and dismissive experiences with institutions, the quality of the therapeutic relationship is itself an intervention. In phase 2 of the counseling relationship, which is typically sessions 5 through 10, the counselor shifts toward exploration and skill building, exploring vocational interests aligned with cultural values, addressing internalized barriers through psychoeducation and narrative techniques, and building practical skills such as resume writing and interview preparation, with cultural context embedded throughout. In the third phase of career counseling, sessions 11 through 16, support action and closure, application support, accommodation advocacy, goal monitoring, and a sustainability roadmap for post-counseling career development. The counselor must remain a learner throughout, and the client's voice must lead all goal setting. The intervention draws on several modalities. Cultural, humility-based counseling and career coaching provide the relational foundation. Practical skill building, including resume writing, interviewing, and job search planning, builds concrete readiness. Collaboration with Indigenous community organizations, tribal education programs, and disability services ensures that Jordan has access to culturally safe pathways rather than only mainstream options that may not fit her context. Advocacy with potential employers and policy stakeholders works to reduce barriers before Jordan encounters them, rather than leaving her to navigate discriminatory systems alone. Flexibility is built into the plan from the beginning. If initial pathways prove inaccessible, the counselor and Jordan pivot toward community-based employment or micro-credential programs that are geographically proximate and culturally congruent. This contingency orientation is a practice principle. A good career plan anticipates structural obstacles and builds alternatives into its architecture from the start. A realistic formulation names anticipated challenges before they arise. For Jordan, systemic barriers are significant and predictable. Limited access to reputable training, geographic isolation, transportation gaps, and discrimination in hiring are not hypothetical risks. They reflect documented structural conditions facing Indigenous women with disabilities navigating labor markets in the United States. Identity conflicts add another layer of complexity. Jordan must navigate between her family's expectations, her Indigenous community's values, and mainstream labor market demands, all while managing disability-related concerns about disclosure, accommodation, and stamina. The counselor's role here is advocacy, not just coaching. That means collaborating with community mentors, tribal education offices, and disability services to co-create a plan that fits Jordan's specific context, partnering with Indigenous organizations to identify equity-committed employers, and documenting discriminatory practices while centering Jordan's strengths throughout. Evaluation in a holistic formulation is not a single endpoint measure. It is an ongoing process that monitors both what the client is doing and what the counseling relationship is supporting. Process measures include session attendance, completion of training applications, acquisition of accommodations, and engagement with support networks. Outcome measures include credential attainment, job interviews secured, internships completed, and job placement in culturally aligned roles, as well as Jordan's own assessment of job satisfaction and perceived cultural safety in her workplace. Ethical considerations are woven throughout. The counselor honors Jordan's autonomy, maintains ongoing learning about cultural safety rather than assuming cultural competence, and attends carefully to confidentiality when Jordan navigates decisions about identity disclosure, advocacy at the policy level. Pursuing systemic change for marginalized and Indigenous communities is not optional. It is an ethical obligation. The Cultural Formulation Approach, or CFA, provides the organizational architecture for this formulation. Adapted from the DSM-IV outline for cultural formulations and brought into career counseling by Leong and colleagues 2010, the CFA offers a 5-dimensional framework flexible enough to accommodate the full range of identity dimensions this case requires. What makes the CFA particularly valuable is its demonstrated applicability across diverse populations. Researchers have applied CFA-informed approaches with African American clients Byers Winston, 2010, Asian American clients Leong et al., 2010, Latina and Latino clients Flores et al., 2010, American Indian clients with Dunton and Klein, 2010, and international students Arthur and Papaduke, 2010. For your own practice, the CFA is not a rigid template. It is a starting point for building a client-specific intersectional narrative that attends to all the dimensions of experience that shape career development. A holistic career case formulation that explicitly integrates race, culture, class, tribal identification, gender, age, and disability does not simplify the counselor's task. It honors the complexity of the client's life. The 5-dimensional CFA structure is flexible enough to accommodate all of these dimensions when the counselor enriches it with population-specific analysis and intersectional thinking. Extending the CFA to tribal sovereignty, however, requires more than cultural psychological framing. It requires explicit attention to treaty rights, collective sovereignty, and the political dimensions of Indigenous identity that current frameworks have not yet fully addressed. Integrating disability into this formulation draws on Dispenza and colleagues' 2019 Intersectional Adaptation Framework, which accounts for identity disclosure and psychosocial conflicts across multiple marginalized statuses. Carry this principle into your practice. The most rigorous career counseling asks not only what a client wants, but what structural conditions make it possible. That is where advocacy, intersectionality, and genuine cultural humility converge.